In a state at the epicenter of the COVID-19 crisis, New York is seeing a disturbing rise in something else. Children with a mysterious inflammatory syndrome that could be triggered by COVID-19.
This is every mother's nightmare. This is every parent's nightmare.
3 children have died and dozens of cases are under investigation in New York State alone. The symptoms are similar to those associated with Kawasaki syndrome, a rare illness that affects young children.
Because it's affecting the heart and it's inflaming the blood vessels, red is sort of the key symptom. The rash and then the red palms, soles of feet.
At this Montreal hospital, doctors have seen between 15 to 20 cases and suspect the patients may have been infected with COVID-19 earlier.
A significant red flag.
Dr. Stephen Friedman is leading an international study tracking approximately 1,500 children who've been tested for COVID-19 in 14 different countries. He says apart from the hospital in Quebec, there doesn't appear to be a significant number of cases in Canada, but there have been more reports in Europe.
It seems that it is a delayed phenomenon in most countries about a month after the peak of prevalence of COVID-19 in a region.
He says unlike Kawasaki syndrome, which usually affects toddlers and young children, those turning up in hospitals with these inflammatory symptoms are older, closer to their teens. Friedman says some of the data from the UK shows that in the majority of those cases, the children have tested positive for COVID-19. But he says all of this needs to be put in perspective.
It's still a very small number of children. Thankfully, way fewer than we're seeing severely affected on the adult side.
Still, he says it highlights the importance of more research to understand just how COVID-19 can affect children. Briar Stewart, CBC News, Vancouver.
Well, to get some more on this, let's bring in Dr. Srinivas Murthy in Vancouver, an infectious disease specialist and a doctor at Children's Hospital. I guess, first of all, what's your message here for parents?
First of all, it's a very rare condition right now, and we're still learning about it, but there's only been a handful of cases across Canada and across North America. So I wouldn't worry that every small fever and every small rash on your child is this. Obviously, if your child looks sick and if there's concerning signs, to seek out care. Every hospital in Canada and every pediatrician in the country has been notified and is well aware of this condition and will react accordingly.
From your perspective as someone who studies infectious diseases, among other things, what does all of this tell you about COVID-19?
If we can prove that it's related to COVID-19, we haven't proven that yet. And there's lots of science going on right now with all of these children to try and make that link. It's a hard link to make scientifically, to be honest. But if we can make that, it tells us that COVID-19 affects children and adults in very different ways. And the reasons for that are very important for us to find out as we learn more about how to develop a vaccine or how to manage it across populations. It tells us that it probably has effects on the immune systems as well, and may have specific effects on a developing immune system in children.
Yeah, sure is interesting to me after all these months how much we still don't know about this. Dr. Murthy, thank you very much.
Have a good day, Ian.